All right, welcome everybody. We are here to talk about where we are, where we're headed, and we're going to kick off this afternoon media briefing with Dr. Jim Cardon, our Chief Clinical Integration Officer, who's going to talk a little bit about some of the numbers that we're seeing. And of course, then we'll open it up. We have three experts with us today. You saw in the media alert. We have Dr. James Cardon, we have Keith Grant, and Dr. Ulysses Wu. So we appreciate your time. And Dr. Cardon, if you could kick it off.
Glad to. Thank you all for joining. Appreciate coming to chat with us a bit. Just figured we'd get out in front a little bit as we've continued to watch closely, and we do get questions around, where we are as we continue to sort of battle trying to get out ahead of vaccines, yet looking at our positive rates in terms of our testing. Just figured it'd be a good opportunity for us to check in and let you know what we're seeing. Obviously, in the state data, there's been an uptick from where we were just a few weeks ago. Levels were really below 1%, and those
fully vaccinated, you have an extraordinarily small.
Those numbers have been creeping up. We've continued to do pretty broad-based testing, both in terms of symptomatic and asymptomatic people, and we're seeing that rise. It's as we look at the different segments, it's not just coming from our inpatient and our ED, it is out in the ambulatory environment as we see it. And those rates have been increasing pretty substantially over the last 2 to 3 weeks. So we're continue to be concerned. We've not seen, and the guys can talk about hospitalizations. They've always been a lagging indicator as well. They are not rising as abruptly as we see in the testing, but they're also drifting up. So as we move forward, just wanted to give an opportunity to try and get ahead of any questions you have, sort of the way we're thinking about this and our preparedness. From our perspective, we continue, although we've shut down a lot of the drive-through locations. We still have plenty of testing availability throughout all of the communities we serve, and to continue to push along with the vaccine, but the administration of that continues to be much slower than we like, and that is a real challenge as we go forward. So I'll stop there and ask Keith, Ulysses, any comments, and then open it up some more for questions.
Keith, I'll let you go first.
Okay. So very consistent with what Dr. Cardon says. We're obviously, we're here because we've seen a significant uptick. We've also seen a significant increase in the percentage of the percentage change. It's not only increasing, but we've seen an increase in the rate of increase.
Okay, just muted channel 8. Go ahead.
Okay. So the last 2 to 3 weeks, we've seen some stability in that rate of increase over, I'd say, the last week. Nothing overly to celebrate at this point in time, but still very, very concerning. And consistent with what we've been saying, and also consistent with what we've been appreciating with the vaccines and its efficacy, a message I think just came out a few minutes ago regarding the fact that for breakthrough cases, only about less than 1% of individuals that's been vaccinated nationally have reported any form of breakthrough cases. And again, breakthrough cases continue to be very low in severity in individuals that are fully vaccinated. So again, we welcome your questions, and Ulysses, anything else to add?
Yeah, just tag on to what both of them said. I think the key point right now is to realize that this still remains, in terms of severity, a pandemic of the unvaccinated. The vaccine is doing its job. We all thought that the purpose of the vaccine was to completely stamp out and prevent disease, but its main goal was to take a deadly disease and turn it into the common cold. And it seems to be doing its job in those who are vaccinated. So the severity, from a severity standpoint, this remains a pandemic of the unvaccinated. But for those who are vaccinated, even though there are still breakthrough cases, and even though there are still some hospitalizations and maybe some ventilations and ICU stays that are required, for the most part, those are all amongst the unvaccinated. I shouldn't say all, the majority are amongst the unvaccinated.
So we just wanted to take a moment for our experts to talk a little, and really the point was to open it up to media, make sure that if you had questions, you could get them answered. So the first question comes from the Winstead Phoenix. Will Hartford Healthcare be reopening drive-through testing?
No, not at the present time. We can pivot to that, but it really becomes one. What the drive-through testing really helped with was just the mass testing we needed to do. We think we can meet the demand we're looking for with our current more distributed model between our sites of care, our urgent care sites, and the work that we've done with Quest, opening up ability to get tested. We've not found anybody having any problem getting a test done. As we've said, the vaccine has really reduced the population this is occurring in, so we're not expecting the incredible numbers we've had in the past.
I have some other questions, but I do want to encourage folks, if you want to ask a question, you can raise your hand, you can go off mute. The second question comes from Tracy. What percentage of fully vaccinated COVID patients are being hospitalized at our facilities?
So percentage fully vaccinated. So I would probably change how the question is set up and answer it in what percentage of our patients that are here right now that are COVID-19 are fully vaccinated. And that's a very, very small number. I think the last time we looked at the data, it's less than 10% of individuals, and even individuals that are hospitalized might not be here for COVID-19 symptoms. Keep in mind, everyone that comes in and that is admitted, we do screening on individuals, testing, and from that we're able to pick up our asymptomatic positive individuals, which a number of the individuals that will experience breakthrough transmission or breakthrough positives, these individuals will be asymptomatic, and a lot of these cases are how we're picking it up. So
the last nationwide number I saw, it's still approximately 90%. Across the country that are unvaccinated that are hospitalized.
Yep.
Excellent. Thanks, Dr. Wu. Do we know whether fully vaccinated people can transmit the virus at the same rate as unvaccinated? Is that why we've been encouraged to wear masks?
I can feel this one. A lot of this is probably coming from the Barnstable, the Massachusetts data, or I shouldn't say data because it's not data, but the cases that just sort of came out of there. And the fear is that the vaccinated will be able to transmit at the same rate as the unvaccinated. And that's sort of what prompted the CDC to really pivot in terms of masking indoors. I don't think that the vaccinated population will be able to transmit the coronavirus at the same rate as the unvaccinated, but I do think that it is higher than we had previously expected as compared to before. And so I do believe that transmission is possible if the reports of high nasal pharyngeal carriage is absolutely present in our vaccinated population, then yes, that could represent a high rate of transmission as well, which again led to the masking mandate, or I shouldn't say mandates, the masking suggestions.
Dave Altamari from the Connecticut Mirror has raised his hand.
Thanks, Rebecca. Hey, Jim, do you have any idea like how many people you tested last week compared to, say, 6 months ago? It seems to me the testing numbers are way down. And what does that mean if we're not testing as many people? Do we really know how many people have COVID if we're not testing that many?
It's a good, David. Yeah, I can give you some numbers. So over the last we watch in 2-week increments. So you can and it's been pretty steady. We did just about 10,000 vaccines over the past 2 weeks for at our locations. That's way down. Yeah, completely a different scale of number than where we had been testing at the height of this. So for sure. But we're also still not just testing symptomatic people or those at risk. We're also testing, as Keith pointed out, anybody who's coming into our facilities for asymptomatic testing, people who have procedures scheduled. So we are getting a bit of a scan. And what's encouraging to me, at least, though our numbers always are a little different than the state numbers and have been, we always had higher positivity rates because of the population we're serving more. again, these are not necessarily driven by ED patients who are having symptoms. This is coming from our others category, which is our diffuse sort of ambulatory spread that we have where we're getting these results from. So although not as much, I still think it's given us a good sense as to what's going on and what's in the environment. Again, the vast majority of those is we're talking about the denominator being different because those who are vaccinated are likely not getting tested right now for the most part, unless you're going into the hospital kind of thing.
Exactly.
And statewide, just to add on to that, when we were at our low, not us as Hartford Healthcare, but the state was probably around 3,000 to 9,000 tests a day. The state, as of, I think the last time they looked, which was July 30th, they were up to 18,000. So testing volume is increasing across the state. But again, to Dr. Cardon's point, not all of it is necessarily for symptomatic people.
Yeah.
Okay, and Eliza, you have had your hand up for a while. Eliza Fawcett?
Thank you. Just wanted to ask about masks in public schools for kids. What are your thoughts on whether kids should be wearing masks in schools? And also, what is known about how transmissible Delta is among kids?
So I will go off the pause there and try to jump in here. The reality is that masking for kids in schools, I know it's a touchy subject. Somehow it's become political. Somehow it's also become a social flashpoint. But the reality is masking for children in schools probably makes sense if they're not vaccinated. In terms of the transmission, I think there still needs to be a lot of data that needs to be sorted out with that. But I think at worst case scenario, we have to assume that it's transmissible for them to others and for them to get it as much as it is for adults as well with the Delta variant.
Thanks so much for that. And just to hop on quickly, do you think that following all the guidance coming out of CDC last week, basically everyone who's vaccinated or unvaccinated should be wearing masks in public spaces and indoor settings at this point?
Well, I think that to tack on actually onto the kids thing, so let's take a step back and let's look at what our lines of defense are. Our first line of defense is vaccinations. That is still our pathway out. When vaccinations either stop happening or we think that cases are going to be rising, the next two steps are social distancing and masking. Social distancing is going to be difficult, especially in schools. And so masking, I think, is going to be the way out of this to prevent for those, especially who have not been vaccinated. And unfortunately, I've already forgotten your second part of your question. And so can you repeat it again?
I was just wondering about the CDC guidance recommending masking for folks indoors, regardless of vaccination status.
So we have always known that indoor transmission is much greater than outdoor transmission. And so outdoor transmission masking guidelines are obviously not that strict if occurring at all. But we do know that indoor transmission with the ability of the Delta virus to be able to transmit virus, we know that it's much higher indoors. And so I fully agree with indoor masking for the most part in an area of high transmission, which unfortunately is becoming everywhere at this point. Keith?
Yeah, I mean, again, it's very difficult to approach this question for a number of reasons at this point in time. You identify the fact that there's a political part to it, and there's also a social platform to it as well. But we agree, and we've seen, the things that we had for tools very early in this is the appropriate information and the right initiatives such as mask wearing and social distancing. It's very difficult to achieve social distancing in schools at this point in time. And I think it's we've proven that masks work. And one of the primary reasons that we don't have, and we touched on this, we don't have a huge population of testing that's happening in kids. We do know kids normally, when they get this virus, they're asymptomatic. So we do believe that, the vaccination process works and it's effective, it's efficient, and it's safe. But it's still not, there's a number of students that still haven't gotten it, primarily because of aging and so forth. But if that's not available, then our best line of defense, in according to Ulysses and the science at this point in time, is masking, and it's hard not to support that at this point.
Thank you, Keith. Thanks, Ulysses. Tracy, you had raised your hand. You're on mute.
Yes, thank you, doctors. One of the things I wanted to ask about, Dr. Grant, was what happens when people get an asymptomatic infection that you're just picking up because they come to the hospital for a diverse, another problem. So I'm sure they're shocked, first of all. So what I wanted to know is, A, what do you tell them to do? And B, what percentage of that 10% that you're picking up actually need to be hospitalized?
That's a good question, and a few pieces of it. So one, I think one of the first thing, the shock is one of the key piece of it. I think individuals have to realize, and that's probably on us to pass that information on, being vaccinated doesn't mean you cannot get infected. And that's one of the key pieces of it. It does mean it does, based on the data, the profound data that we do have, it means that you have a significantly lower risk of being critically ill and of dying from this disease process. When someone comes in and they're asymptomatic, and we do have that discussion with them, that conversation with them, generally what happens is the communication based on the fact that you're positive with COVID-19. These are the steps that you need to take. At this point in time, we do believe there's a lot of data, some good studies that came out of Israel, I think a few months ago, that stated that individual who's been vaccinated has a lower risk of transmission. That study was not done with the Delta variant predominant at that point. So I'm based on the fact that Delta variant is so much more contagious than the B117 alpha variant that we had before, I would say that study at this point in time might not be completely relevant. So we generally have a discussion with these individuals saying, you're positive, at this point you're contagious, you might be doing very well, but you might also have the ability to pass this on, and we'll help them through that process itself. We also use the opportunity, if we can, to communicate with their families, members of their families, to know if there's something we can do to help them through this process itself. In regards to how many of these individuals from a percentage perspective are in critical care, I think, so the last data that we looked at, Ulysses, and correct me if I'm wrong, we looked at or vented patients, and we had no patient that was ventilated that was fully vaccinated.
What about hospitalized?
Hospitalized for symptoms, I don't have that data. That data I can make available for you guys, though, because I don't have it on hand right now, but we do have that data.
We appreciate that.
So,
just one more question. As you know, the White House has come out and said that they consider misinformation or disinformation, I guess misinformation, to be a sort of driving and pernicious cause of the spread of the pandemic. And I wanted to know two things about that for you as physicians. The first thing would be, where do you see this kind of misinformation coming from? And secondly, what particularly about the misinformation, in terms of what people think it will do that you don't believe it will, bothers you the most?
So I think one thing right now, there's a huge focus on, and you can see how we started this actual conversation itself, with breakthrough disease, right? Breakthrough infection. And I think a lot of it is, from an epidemiological perspective, I'm very interested in the breakthrough cases, because a number of things must be going on, right? And Ulysses, myself, and Dr. Cardon have talked about this. But it is not meaning that the vaccine isn't working. And I think that's one of the things that there's numbers coming out now that a lot of people are like, I told you it wasn't going to work, right? But we still have over 1 billion people across the world that's been vaccinated. And the reprieve that we got from this virus over the last, I would say, 2 months came from the mass amount of individuals that's been vaccinated. Additionally, the visceral impact of people now getting positive and people dying from the disease again at this rate has drove people to starting to rely on getting vaccinated. We've seen a significant increase in vaccination rates nationally. Over 700,000 vaccines were delivered over the last few days on average. So that's good news, but it's gotten us to this point again in order for us to start having this discussion. So I do believe those are, for me, the key things are the breakthrough cases. The conversation shouldn't be like, I told you so. It should be like, it should basically appreciate the fact that the vaccine is doing exactly what it's supposed to be doing. And that is, it is possible for you to get infected. Most of these people are going to be asymptomatic. And even most of these people, well, these patients will not be in critical care and they will most likely not die.
Can the other two, Dr. Wu and Dr. Cardon, answer the question of where you think the misinformation is the worst and which part of the misinformation bothers you the most?
Go ahead, Ulysses, you're up.
Oh, well, I mean, you have 4 hours. I could probably sit here and wax poetic on this. So obviously the internet, social media is driving a lot of this. I have a saying for not just coronavirus, but a lot of things. When science meets the internet always wins. And so I think
The
that
record, Dr. Wu, we're on the internet right now, passing along good information, which is why we're here.
That is true. So the good, you're absolutely right, and so I apologize for that misstatement. But I should say, science versus the dark web always wins, and so so that kind of answers the first part of my question. But the thing that bothers me the most is that this has polarized our country to the standpoint that everybody is bunkering down in their ideological circles. And because they are bunkering and hunkering down in their ideological circles, they are listening to their own echo chamber at this point. And because we are listening to our own echo chamber, the further you get into that echo chamber, it is almost impossible to be provided statistics. I mean, they always say, what is it? There's lies, damn lies, and then there's statistics, but it's almost impossible to provide statistics that may be pertinent and useful. We haven't, as Keith has pointed out, we have an overwhelming wealth of knowledge and information that points to us that the sun does rise in the east and it sets in the west. But I know that is not always believed. And I think that is the thing that bothers me most with regards to the disinformation. And I know every single time we do this, I always provide a movie reference. So I'm just going to leave you with this one. You know, sometimes we can't handle the truth. And so use the movie if you remember that one, but I'm going to pass it on to Dr. Cardon.
Nothing brilliant to add here. I guess two things. I do believe there are people out there who are truly afraid, and where this hits fertile ground, they get quite passionate. They think they're doing the right thing. They are terrified of this and somehow feel that they need to raise a voice to make sure people are not making mistakes. That the part doesn't bother me. Those people have always been there. It takes work to get over those kind of barriers to where they have real or experiences that make them really pause. What bothers me the most is the people who are fomenting these things for a different agenda than the health and well-being of the people. And there's a lot of people coming at that. People who like to create chaos, people for political agendas, people for other motivations. But they feed it. They can twist the facts to make their story the way they want it, and it helps. And it really compounds when people are looking for facts to support the reason they're anxious in the first place. They then pass it along. So it becomes a really difficult. But when you see that the purpose of this has something that's very nefarious, in my view, compared to what you really should be talking about, is what just so frustrates me as it goes forward, because they're putting people's lives at risk for an entirely different agenda, and that just seems really troubling.
Dr. Cardon, thank you. I'm going to combine two questions in one for the team. So this is from Brian Hellenbeck and Marilyn Godin. What is your take on mask wearing? You touched on that a bit. Do you think mask wearing should be mandated or leave it to people?
Keith, you want me to, since you guys weighed in on masks, let me give you I think mandates are really hard, especially when you got a whole bunch of vaccinated people who have moved through, and that's just going to be a tough message. what my advice when I talk to is you have to do a risk assessment of where you are and what environment you're in and who you're putting at risk. Understanding you could be a vector, perfectly fine. If I have an elderly person at home that I'm interacting with who's been vaccinated, but we know that the vaccine, that's the group that may be most at risk. If I'm walking into a crowded environment, I'm wearing a mask because I just don't want to make sure that I'm not giving this to somebody else, even if I feel myself are being protected. The more crowded, the more folks you think that are congregating where you have no idea what that population really is and how cautious you can be and how much distance you can have and the air ventilation's poor. Those are the places to where you say, okay, I'm making an assessment here that this is not a good place for me to be without a mask, so you wear one. Local friends, you know them, they're all been vaccinated, you got good ventilation, you're out, you're not exposing any kids or adults or people with impaired immune systems, more liberal, and don't necessarily have to be walking around with a mask everywhere you go. So that, I don't know that, that would be, and how you make those assessments is all going to be dependent on just being aware. But this is something we just have to factor into our thinking as we're moving in through these environments that are pretty diverse depending on where you're going.
Eliza Fawcett, you have raised your hand.
Sorry, I just had two more questions. First, Keith, you had mentioned a significant increase in vaccinations nationally. Is that something you're also seeing in Connecticut or particularly within your system?
I don't know if Dr. Cardon has the number. I know in Connecticut.
Yeah, in our colleagues I had, Keith, yeah, we've seen a nice, with the renewed attention and no doubt the fact that we've mandated vaccines, we are seeing a nice increase in folks who have navigated their way to saying, okay, it's time for me to get vaccinated, and we're encouraged by that. A lot of work going on with Keith and Ulysses and the team, all getting the information, the education out there, but we are seeing those numbers move, which is encouraging. Last I saw is we were, for our colleagues, sort of in the 80% range. I think we're approaching or just past that as I looked real quick.
So I just also wanted to ask, sorry, finally, when you talk about the Delta variant being so much more contagious, how do you help just kind of the average person understand what that really means? Like, is there a metaphor or comparison that you will often use?
That's a good question. I don't have a metaphor, but just one of the things that we should really look at. So at its peak, so when the Alpha variant took over, at that point we had recovered from our highest point of cases, right? Our daily cases. And at that point, the Alpha B117 variant was 50% more transmissible or more contagious than the variant we had at that point predominantly. And to now, at this point, the Delta variant is about 40 to 60% more transmissible than the Alpha variant. So individuals who are not vaccinated, who are very liberal with that risk assessment process that Dr. Cardon speak of, which we really should talk about a lot more, they are putting themselves to a factor of exposure that not only is more than 50% more than the most deadliest part of the virus, but even 40 to 60% more than that, 50% more, if that makes sense. I don't know, Ulysses will have, I'm pretty sure he'll have a really good analogy for you guys.
Well, I mean, you know my standard analogy, and I know you're going to cringe at it, but it's, a virus is going to virus, and that's what it's going to do. And so, yes, this is more transmissible. What we're seeing is we're seeing a more fit virus that is able to infect and transmit. If you're looking for, in terms of an analogy, what would be the best? I don't have a good one. I think the chickenpox analogy is actually pretty good. Chickenpox is highly infected. But the thing I want to do is I want to take a step back from that and say, yeah, it's much more effective, but we have almost 650,000 people dead in our country. This thing's already pretty darn infective to begin with. And so it's not like all of a sudden, oh, it's like the chickenpox. Now I need to get a vaccine. I need to get a mask. That should have been going on this whole entire time. And unfortunately, I don't mean to be the bearer of bad news, but if we don't get this under control, there's another Greek letter coming down the road beyond Delta that will make Delta seem like, me in the weight room, which is like nothing.
Julia Bergman, you have been very patient.
Thanks. There was a recent study, I think it was by Kaiser Health News, that talked about, it was a survey of vaccine hesitancy, and talking about a lot of people who are uninsured are still hesitant about getting the vaccine. There's still a lot of concern or misinformation around the cost of the vaccine. Wondering if you guys are seeing that within the system, and how you're combating that, or any sort of correlation between people who don't have health insurance and getting vaccinated.
I can take that. One, it's don't have anything specific in terms of being breakdown, because we don't necessarily track whether you have insurance or not to get the vaccine. Our percent that are going to the priority zip codes continue to increase. It's just disappointing in that the total number of vaccines we're administering in a given week is just way below what we would hope to see. But we're in the 45–50% of vaccines are going to all the priority zip codes, which is our placeholder for the more at-risk population and the uninsured and those who don't have any insurance whatsoever. We're doing, and just to give you a number, 1,000 a week now, where that we used to do that at one site in one day pretty straightforwardly. So that's really the kind of numbers we're seeing. And it's not for lack of access. It's just a lack of folks raising their hands still.
One last question about unvaccinated folks wearing masks and whether or not we believe in the honor system. Are people actually wearing masks if they're unvaccinated?
I hope so. I hope they are, and I also hope people are indeed doing some form of risk assessment every single time they decide to socialize, or putting themselves in a position where they're within 6 feet of someone for an extended period of time, or if they're symptomatic, or if they've been exposed to someone that's been symptomatic. Testing is still available. I'm hoping people are also getting tested. I'm also hoping people are talking to their neighbors if they've been vaccinated and they believe they can add some knowledge and help their neighbor through some thought process that's probably going to help them to a different set of decisions. So I do hope so, but that's exactly what we have right now. I also hope, a lot of people talk about what's the long-term impact of the vaccine. Like, we were one of the first people in this room, we were one of the first people that took the vaccine, and we did that hoping that the science is true, and relying on the data, and hoping that 5 years from now I won't grow an extra arm. But knowing that this is the right thing to do, not for me. I think I'm pretty healthy and I'll survive if something does happen to me. And I think a lot of people think that way. But, I do have kids, and I do have my grandmother that I love her cooking dearly. So I'd like to go over there all the time. So I hope so. And I think that's, at this point in time, as much information as we have, there's a lot that we do have that's just going to be dwell on hope. And that's basically it.
I think Keith hits the nail on the head with that. Sorry, just to jump on really quick. We need to look at vaccination and masking as a village at this point. Yes, obviously a lot of this is about personal choice and it's about us. But the plea that we would make is that it takes a village to be able to get out of this. I want Keith's grandmother's home cooking to stay around as well, because she is phenomenal. And in all honesty, the vaccinations and maskings are not just about us. Primarily, yeah, it is about us, but it is about our circle, the Venn diagrams that we live within.
That's great. Any questions? Tracy?
Forgive me that you can always count on me for 1,000 more questions. Dr. Wu mentioned the analogy that the CDC put out, that the virus was as infectious as the chickenpox. And I recognized when I heard it that many people today, especially young people, have no experience with the chickenpox. And so it was not very helpful. Wonder if you could, I think the number that you talk about is the R0 number, the number of infections one person, a person who's infected is likely to give to another. And I wonder if you could give that number for chickenpox.
Ulysses will get that number. One of the things I'm going to say about the R number, R factor, actually, it is the R factor, right? So one of the things I will say with the R factor, for us, it's difficult to tabulate now for COVID-19 because the community prevalences are so different. And so even in Connecticut, and I had this conversation recently, So in Connecticut, we look at it at 2.7, I think 2.7, almost 2.8 right now. But if you look at that 2.7 and then you look at where transmission stands generally with our vaccinated individuals, then, you know, there's some communities that are 70, 80% vaccinated. So that 2.7, is it really representing Connecticut in its truest? Because we have communities that might have a much higher, and in those communities, we might have an R factor that is significantly higher. So if you have 10 individuals that are standing around, and from the 10 individuals, you have 2 people that's been vaccinated within that community, the R factor stand a chance to be significantly more potent. So at this highest point, the COVID-19 virus, when we looked at R factor, I think it was a little bit over 2. And we've moved from the alpha, from that variant to the alpha to the delta. So at this point in time, I don't have the number for the R factor, but I would say it would be pretty significant.
When just for those who are more looking like me and less like you guys, when the family of 5 of us had one of us had chickenpox, my mom said, "Hey, why don't you go just drop off a little lunch for your brother who's sick up there?" The rest of us were avoiding it. We didn't have to stay long. We didn't have to be in the room for a while. Nobody camped in the room all the time. It was just walking through and saying, "Here's your lunch, buddy," and I'm getting out of here. But we all ended up getting chickenpox at the same time. She sort of said, "I'm taking care of all 5 of you at once. I am not doing this for the next 3 months." So
Absolutely.
it was pretty easy for us to catch it. I can just tell you from personal experience.
Ulysses, do you have that number?
Yeah, the number is thought to be around 6, anywhere from 5 to 9. And so that's thought to at least be 2.5 times more transmissible than the original variants, which is around where chickenpox is, and it's more transmissible than MERS, SARS, Ebola, the common cold, smallpox, and seasonal influenza. So I don't know if that helps.
Dr. Grant, I thought what you said about the positivity rate was really interesting. You mentioned that if we're at, as a state, 2.8% positivity, but you have, as you mentioned, certain communities have exceptionally high vaccination rates. Others are still, our major cities are still in the 40s. And I wonder if you could just explain that a little more detailed. Why would it be that those communities have a higher transmissibility rate, sir?
Yeah, and again, this is all statistics supposition, right? So if we're saying the entire Connecticut's about 2.7, 2.8, and we know there's community, or primary defense against this disease process, against COVID-19 or SARS-CoV-2, is the vaccine. And if we have communities that are 80% plus vaccinated, these communities probably will be on the low end of that prevalence rate. However, in order to get to that 2.7, we most likely will have individual or communities that are on the high end of that rate. And that high end, I'm assuming right now, it's not going to be close to 2.7. It's much, much higher than that. So, and when Ulysses talk about this is now becoming a pandemic of the unvaccinated, and it is a very, very true term or concept. And a lot of the unvaccinated communities at some point in time will have that data, or get to hopefully look at that data. It should be a very scary time for individuals that are unvaccinated within, if you look at the context of that at this point in time.
There's one last question from Facebook. Have we gotten to the point where we need to use emergency department or other parts of the hospital to treat COVID patients? And Dr. Cardon and I were just talking about that.
Yeah, no, we have plenty of capacity. Like we said, the number of folks who are hospitalized still remain relatively small. We've talked to you guys before. We were hovering between 10 and 20 for a while, drifted under 10 when, a couple of months ago. I think we're at 36 or something around that, Keith, if you have the number more specifically. So still nowhere near where we were, where it is. And I don't think we'll get there, simply, again, because the denominator of the population that is going to get sick enough from this has been so reduced by the effective vaccination strategy we've done. So right now, we're not anywhere near any challenges in terms of taking care of these folks.
We want to thank everyone for your time. Thank you to our experts. Thank you to our media. We really appreciate it.
Thank you, guys.
Thank you.
Thank you.
Thank you.